Good morning, Kevin. Thank you very much for talking to us about Willis. So as a practicing physician, what do you think about the career of Willis as a medical doctor?
Well, I think it's very, very difficult to really get your head into the world of 17th century Oxford. And it's been written about by many people, so one gets a sort of flavor of it. To really enter into the mind of somebody who was trained in a very different sort of tradition is, of course, very difficult. But I think if you read Willis's account of the patients he saw early in his career, at least, there is a certain similarity to the way that we think, which strikes me as very modern. And I think this is one of his great legacies. I mean, every medical student will, of course, know about the circle of Willis, but what they don't realize is the extent to which the way that he wrote about medicine and the way that he took his observations and the curiosity about the fundamental correlation with anatomy was something new at the time. And actually, we have a tremendous legacy of that. So I think I feel that when I read the accounts of his cases, there are many differences to the way that we would approach it. But what I see in front of me is somebody who's fundamentally curious, somebody who is simply not coming to the patient with a set of dogmas, somebody who wishes to explore and understand what's going on. In that sense, he's a very modern thinker.
So Willis's career was interrupted during the Civil War. So we have to really go back here and just have a look what was happening when he was a medical student. So in fact, his studies were disrupted.
And that seems to be to his advantage in the normal, 10 to 15 years of slavish adherence to Aristotle and Galen and Hippocrates was interrupted by the Civil War, which may have been, others have commented in writing about Willis that this may well have helped him because it meant he had to sort of go out there and practice without unencumbered by these kind of dogmatic views. I mean, they clearly, if you read his approach to therapy, I think he was very conventional probably in that he only had available to him a variety of strange and exotic remedies such as mare's milk and various things that he prescribed. But perhaps his medical studies being cut rather short was very much to his advantage because he was more of a blank template when he actually went out into the world and started observing. And he was relatively young, I think, in his late 20s, around 1650 or so, when he started practicing and went out into the surrounding towns of Oxfordshire, essentially touting his trade in the marketplace. And through that, started to see cases and started to make observations. And so I think he's very much in the tradition of empirical medicine, learning through experience.
So looking at these texts, what is your feeling? What was the life of a practicing young clinician in those days? Because probably these clinicians, they had to compete not only with other physicians, but they also had to compete with charlatans, with practitioners without any qualification on these marketplaces like Abingdon.
Yes. So, I mean, the Royal College of Physicians was established by Henry VIII specifically to address the problem of charlatans and quacks. I didn't necessarily think it succeeded in that, but there is the concept of the registered medical practitioner and the unregistered medical practitioner, whether in reality the patient was really benefited from seeing one or the other is probably questionable until perhaps the early 20th century. But it's true that it was a market, wasn't it? I mean, he became the wealthiest person in Oxford eventually, and there must be a reason for that. And he may just have been very canny, but I suspect that there were many qualities that he brought to the encounter with patients that patients valued, appreciated, and through word of mouth his reputation spread. So people have speculated that as a younger physician, he would have been called in later if others had failed. And if you wanted to be cynical about it, you could say, well, you can't really lose that way, because if the patient dies and other people eminent physicians have seen the patient, then you're in the same position and you can't be blamed. If through some twist of fate or miracle the patient survives against all odds, you can then get the credit if you come in at the end. That would be the cynical interpretation. But I think it's clear that he was operating in a marketplace and was very successful.
So Kevin, what written evidence do we have that this is how it was all working, his cases, where he practiced, how much did he charge? So what kind of evidence do we have to judge all that?
So I think certainly from his early career, most of his evidence comes from the case books, which only really span a couple of years and were written up by Kenneth Dewhurst. And I think these were found in a property that was sold. Yes. And these are little vignettes of rather short descriptions of him attending people. He describes their social background, and he describes what he saw in front of him, which was largely people with fevers and pain. And what actually is very interesting is the way that he responds to their symptoms and their illness behavior. So he describes in some detail how they react to the pain or the fever, and he can occasionally describe this as anxiety or hypochondriasis, which, you know, makes me feel that he was thinking in a rather kind of general sense about how people have the underlying illness and how they respond to it. The other interesting thing is the degree to which he decides quite rapidly in some of these cases that he can do nothing, and gets back on his horse and trots off and says goodbye to the family, which again may be pragmatic, but you also get the sense that this is somebody who understood the limitations of medicine, who maybe compassionately thought that illness had won and it was time to retreat. So, again, I think in contrast to people who may have continued striving until the patient died, he seems to have been somebody with a rather clear view about what he could and could not achieve.
So after you read some of these cases, would you like to discuss some of them in more detail? Was he progressive? What was his understanding of the disease? What did he get right and wrong? And how is it relevant for today's medicine? So would you like to select or pick a couple of interesting cases?
Well, I think actually my feeling is in general that once he stops describing what he sees, it's he doesn't necessarily have very many insights at this stage in his career into what's going on. I mean, it's in a way, it's in marked contrast to what came later, where he was making observations of neurological conditions and other things with some sort of anatomical basis. I think his mind at this point was based on chemical notions of disease, some of which, of course, might well be relevant, but I don't think he necessarily is rooting what he's describing in any kind of anatomical framework. And that seems quite striking. So in that sense, it's rather more typical of what came before, that illness was due to imbalance of various fluids or chemicals in the body rather than an anatomical basis. He very rarely mentions, as far as I can see, specific locations of the body or an internal sort of framework for disease based on organ systems.
But for instance, in epilepsy, he excluded the possibility that it's coming from the dura or from the cerebrospinal fluid. He definitely was pointing to maybe in that particular instance, he did find the anatomical substrate of epilepsy, for instance.
Yes, but he kind of characterizes things, perhaps, if you use these as metaphors, they become more plausible. Explosions in the brain or chemical events. So and fermentation was a kind of common concept. Actually, if you treat these as metaphors, and in fact fermentation he sees as a process of degradation, I think, and decay, even applying it perhaps to disorders of aging such as dementia. And in that sense, it's rather interesting because it has a certain kind of resonance with our concept of degeneration.
For instance, he is writing about Myasthenia Gravis.
So if we fast forward, 20 odd years to Anima Brutorum, his description of myasthenia has been repetitively described by others from the Latin translation. And I have to say it's quite an atypical description. And the short description that I've read describes somebody who had speech arrest effectively. So he provides a general background and says that there are people who are strong in the morning and by lunchtime they're weak. So that's perfectly plausible. I mean, in fact, it's an acknowledgement that neurological symptoms can be transient or recoverable or reversible, which is a very important concept in contrast to things which are irreversible. So the specific case that's often used and has been quoted by many, I have a patient, a prudent and honest woman, who for many years has been subject to this type of spurious palsy, not only affecting her limbs, but also her tongue. She speaks freely and readily enough for a while, but after long periods of speech, or if she speaks hastily or eagerly, she is not able to speak a word and is mute as a fish. Well, do I think as a neurologist this is typical of myasthenia? I would say, I mean, it may be that he simply describes it differently, but people with myasthenia would more typically become slurred or fatigued in a sort of more progressive way rather than undergo this kind of arrest of speech. And then perhaps curiously, he says her voice does not return for 1 or 2 hours. That's a little unusual and doesn't really fit very well into what we know about neuromuscular transmission today. You would expect it to come back much sooner than that. So whether this particular thing about the speech is myasthenia or not, I can't say, but he certainly recognized the idea that things were reversible and that there were disorders of fatiguing.
And also he put the smooth muscles of the intestines in contrast with these somatic muscles. So he noted that the intestinal function, urinary function, they were all retained in these patients in contrast with the somatic muscles. So he was thinking about the patient as a whole. So that's an interesting. How about his discoveries on the Parasitis Reliides?
Yes, I have to say this is a very amusing sort of anecdote, really, of a woman who was deaf, but it was somehow discovered that if she, in the background noise, she was able to hear more effectively, such that her husband employed a drummer to come in and drum around the dinner table so that she could hear what was being said, which is a very picturesque sort of description of something which is a recognized phenomenon where conductive deafness can be overcome in the context of loud noise, possibly through some kind of recruitment of auditory pathways. I'm not entirely sure of the mechanism, but it's recognized. So again, just a testament to his powers of observation. And actually, neurology in particular, perhaps has retained this in modern medicine even more than other specialities. The concept of the story, the narrative, is absolutely central. And neurologists spend a lot of time listening to patients. And if you've seen tens of thousands of patients or thousands of patients with one particular disease, and you listen to the narrative and the arc of that narrative, then what you do almost unconsciously is you recognize when something feels right and when it doesn't. And that's a very kind of clinical way of thinking, which I think, starts, if you like, in these kind of observations in the time of Willis.
How about the case of the Acalasia of the Cardia? That was an interesting case. It was about a
rare case of an Oxford man demonstrates how continuous vomiting may be caused by occlusion of the cardiac orifice of the stomach.
Yeah. And then he prepared an instrument from a whale bone to push the food down, and that person lived quite happily for 15 years, apparently.
Yeah, so I imagine that these stories really were communicated very effectively, both by his acolytes, but also by his patients. And the interesting thing, actually, is that sort of transmission of a physician's reputation hasn't gone away. And in fact, in the age of the internet, has become more and more, we've gone back to the idea that individual testimony, I mean, obviously medicine for thousands of years has been about the healer and some sort of mystical, magical process that may be contained within the individual and the power of that person. So that's something which is atavistic and which is still in the consulting room today. When you see a patient, they come and see you. If they have a rare disease, they come and see you because they have gleaned a view from somewhere that you know something somebody else doesn't. So that can either be simply a question of your knowledge or something about you which is rather more mystical. This is still sitting there in the room when you see a patient today. So I think he will have gained reputation from these kind of cases that will have spread far and wide, and undoubtedly contributed to his wealth, his reputation, and his ascent in Oxford intellectual circles as well, to the chair of natural philosophy, which maybe that was typical in those days, was quite a young age, and also perhaps political, in the sense that he was a royalist, and in the Restoration he found favour.
So what do you think? What is the message for us today from Willis?
Well, I think he occupied an intellectual context which was a pivotal point in the development of the scientific method. And Oxford was one of those places. The Royal Society came out of this group of people who, I suppose, questioned dogma, did not accept received wisdom, were willing to experiment, were willing to use observation to make generalizations, concepts, theories that could be tested. And while this obviously had tremendous benefits in other forms of science, in astronomy, in chemistry, etc., in medicine, you could really say that Willis is an archetypal figure. He is somebody who went on a journey from, a sort of type of medicine that really hadn't changed very much for several thousand years, and into one which was characterized by a questioning attitude and something based on empiricism, on observation, on the anatomical and clinical correlation, which is something that has lasted, the full 400 years and is very much alive today.
And some of these principles actually integral part of the training of medics today, teaching them at the bedside, critical thinking, combine academic work with clinical work, and publish all this. He was very prolific in publishing.
Cerebral anatomy is a bit like a sort of MRC grant or something, because he got together a group of people who were his research team and gave them tasks, and they produced a publication at the end of it. So that is quite a modern concept as well, because he seemed to have decided, as far as I can understand, to go about it in this way and organize it. It wasn't a retrospective, cobbling together of things. It was a project, and one which was very successful.
Kevin, thank you very much for talking to us today.